sir. My dear friends, so topic of today's presentation is carbon monoxide poisoning. As you all know, it is very degree and this is the department of medicine. So these are the contents we will discuss today. First of all, we will discuss about properties, then sources, then mechanism of action, similarly fatal dose, clinical features, diagnosis, management, autopsy findings, and last but not least is medical legal aspects of carbon monoxide. At first, properties of carbon monoxide. Carbon monoxide is a colorless, tasteless, non-irritative and odorless gas, lighter than air. It is produced by incomplete combustion of carbonaceous material. यसमा चाहिँ दुईटा कुरा बुझ्नुपर्छ, एउटा कम्प्लिट कम्बक्सन र अर्को इनकम्प्लिट कम्बक्सन. कम्प्लिट कम्बक्सनमा चाहिँ अक्सिजनले चाहिँ कार्बन डाइअक्साइड निकाल्छ भनेपछि इनकम्प्लिट कम्बक्सनमा चाहिँ अक्सिजन चाहिँ इनकम्प्लिटली अक्सिडाइज भएर चाहिँ कार्बन मोनोक्साइड मात्र निक्लिन्छ, जुन चाहिँ एकदमै टक्सिक हुन्छ एज कम्पेयर टु कार्बन डाइअक्साइड. इट कम्बाइन्स विथ क्लोरिन एन्ड फर्म्स कार्बोनाइल क्लोराइड विच इज कमनली नोन एज फस्जिन. bonds with blue flame है, अब हाम्रो आगो बाल्दाखेरि जुन नीलो बलेको हुन्छ त्यो कार्बन मोनोक्साइड त्यहाँबाट निक्लिन्छ. Then sources, fire produced whenever there is a incomplete combustion of carbon fuels such as wood, charcoal, kerosene, automobile exhaust, tobacco smoke, and generates in gunpowder, mines, and blast of explosives. So these are the sources of carbon monoxide. And then we understand the mechanism of action. So carbon monoxide has 230 to 270 times more affinity for hemoglobin than oxygen. Oxygen भन्दा चाहिँ यसको चाहिँ hemoglobin सँग चाहिँ 230 times more affinity रहेछ. Thus it displaces oxygen from its combination with hemoglobin and forms a relatively stable compound known as carboxyhemoglobin. Formation of carboxyhemoglobin results in reduced arterial oxygen content and causes tissue anorexia. अब अक्सिजनलाई हटाइदिन्छ अनि आफूबाट जोडिन्छ भनेपछि टिस्युहरूले अक्सिजन पाउन सक्दैनन्, त्यस कारणले के हुन्छ भने टिस्यु एनोक्सिया हुन्छ, टिस्युले अक्सिजन पाउँदैनन्. Furthermore, carbon monoxide causes a left shift of the oxyhemoglobin dissociation curve, affecting oxygen offloading from hemoglobin to the tissue. है त त्यो कर्वलाई चाहिँ लेफ्ट र साथ MCQ हुन्छ. The resulting effect is the decreased ability of blood to carry oxygen and deliver to the tissue. यो सबैले गर्दा चाहिँ के हुन्छ भने चाहिँ हैन टिस्युले चाहिँ राम्रोसँग अक्सिजन पाउँदैन. Fatal dose and fatal fate. The average atmospheric concentration of carbon monoxide is usually less than 10 parts per million. It is normally present in the atmosphere. The atmospheric concentration can exceed 100 parts per million in heavy urban traffic and during periods of atmospheric stagnation. अब एकदमै पोल्युटेड सिटीलाई काठमाडौँ अलिकति धेरै पोल्युटेड छ भने चाहिँ 100 सम्म पुग्न सक्छ, जसले चाहिँ एफेक्ट गर्छ. So here is carbon dioxide concentration and fatality. Right, 0.2% भयो भने चाहिँ fatality within 4 hours. Similarly 0.4 within 1 hour, and if concentration of carbon monoxide is 10, then fatality average within half an hour. Now we will understand about the clinical features. At first, acute poisoning. The severity of poisoning usually depends on the percentage of carboxyhemoglobin. Thus, the signs and severity depends on the degree of saturation of carbon monoxide in the blood. Blood मा जति पनि कार्बन मोनोक्साइड छ त्यति नै यसले चाहिँ त्यस अनुसार चाहिँ यसले आफ्नो साइन्स एन्ड सिम्पटम्स शो गर्छ. The formation of carboxyhemoglobin can lead to anorexia, which weakens the vascular wall, anoxia, which leads to the degeneration of nerve elements, weakening of the heart due to the lack of nutrition, and ultimately death due to the deprivation of oxygen. भनिसके टिस्यु एनोक्सिया छ, त्यसले त vascular wall weak हुन्छ, भनेपछि नर्भहरू राम्रोसँग अक्सिजन पाउँदैन, त्यसले चाहिँ weakening of the nerve degeneration हुन्छ, weakening of the heart vessels हुन्छ, and ultimately death. Now we will understand about the percentage of carboxyhemoglobin and signs and symptoms produced in carbon monoxide poisoning. So 0 to 10 mg% of carbon monoxide भयो भने चाहिँ त्यति खास सिम्पटम्स एप्रिसिएबल सिम्पटम्स आउँदैन. त्यस्तै गरी 10 to 20 भयो भने चाहिँ माइल्ड हेडेक सुरु हुन्छ. सिमिलरली 20 to 30 भयो भने चाहिँ इमोसनल इन्स्टेबिलिटी हुन्छ. 30 to 40 mg% भयो भने चाहिँ हेडेक इन्क्रिजेस हुन्छ, कन्फ्युजन स्टार्ट्स हुन्छ. Similarly 50 to 60% भयो भने चाहिँ मिमिक्स ड्रमनेस हुन्छ, एडिक्सिया हुन्छ, है त लस अफ कोर्डिनेसन हुन्छ. Similarly, if the concentration of carbon monoxide hemoglobin is more than 70%, then it leads to coma and ultimately death. So now move towards chronic poisoning. This is due to frequent exposure to carbon monoxide leading to tissue erosion. Seen in people working in gas pumps, automobile workers, traffic police, house and shops near every traffic roadside. अब ऐसे जो व्यक्ति चाहिँ कार्बन मोनोक्साइडसँग चाहिँ नियमित रूपमा एक्सपोजर भइरहेको छन् तिनीहरूमा चाहिँ अब यस्तो क्रोनिक पोइजनिङहरू देखा पर्छ. Signs and symptoms include nausea, digestive upset, dull frontal headache, palpitation, aggravation of angina, anemia, visual disturbance, loss of sensation in fingers. There may be symptoms of atrial fibrillation, bundle branch blocks, atrioventricular blocks, abnormal left ventricular function, decreased cognitive ability, loss of memory, mental retardation, psychosis, Parkinsonism, and incontinence. This is the signs and symptoms of Alzheimer's. Now, what are the differential diagnoses? You should keep in mind. First is alcohol intoxication, similarly cerebrovascular episode CVE, meningitis, encephalitis, diabetic, insulin coma. Then now we move towards its diagnosis. How will we diagnose it? First of all, misdiagnosis is expected because of the diagnosis and broad spectrum of complaints. Symptoms often attributed to viral illness. So signs and symptoms एकदमै अब अरूसँग चाहिँ मिल्दोजुल्दो हुन्छ त्यस कारण चाहिँ झुकिन सक्छ मान्छेहरू भाइरल इल्नेस भयो कि इन्फ्लुएन्जा भयो कि. History is very important. The following shows alert suspicion, winter months, exposure to the previously named sources, and when more than one patient in a group or household in particular enclosed site presents with similar complaints. एकचोटि सबैले एउटै सिम्पटम्स लिएर आएर चाहिँ सस्पेक्ट गर्नुपर्छ. So in laboratory findings, carboxyhemoglobin analysis can be done by direct spectrophotometric measurement in specific blood gas analyzer. Beside pulse carbon monoxide oximetry is available. Breath carbon monoxide monitoring is an alternative to pulse CO oximetry. त्यसबाट चाहिँ टेस्ट गर्न सकिन्छ अनि अमाउन्ट अफ कार्बन मोनोक्साइड इन ब्लड कति छ पत्ता लगाउन सकिन्छ. So how will we manage the case of carbon monoxide, right? First of all, remove the patient from a ventilated environment and shift the patient to fresh air immediately. Oxygen administration. Hyperbaric oxygen is considered to be beneficial. Convulsions should be treated with benzodiazepine. Mannitol for cerebral edema. Gastric lavage in early stage helps in preventing aspiration pneumonia. To prevent lung infection, antibiotics are given prophylactically. A whole blood transfusion is beneficial. These are the management procedures. Then, similarly, there is also an antidote. Few authorities consider hyperbaric oxygen as a specific antidote that may help reduce neuropsychiatric symptoms. However, hyperbaric oxygen has its risks such as cerebral gas embolism, rupture of tympanic membrane, visual deficits, and oxygen toxicity such as convulsion and pulmonary edema. So we should be very careful while giving this antidote. Patient with a carbon monoxide hemoglobin level greater than 25% should be given SBO with little CO2. So what are the objective findings that we see in this carbon monoxide poisoning is? First of all, let's talk about external findings. So as we all know, it's a cherry red coloration of the skin, mucous membrane, postmortem staining, blood tissue and internal organs. The red liquidity is usually associated with the carboxy hemoglobin level more than 30% of carbon monoxide. In dark skinned individuals, fingernail beds can be examined. Fine food at the nostrils, mouth, blisters of the skin over dependent areas or bony pressure points such as buttocks, calves, wrist, and knees due to cutaneous edema. Now, what are the internal findings? In lungs, there is edema and congestion. Similarly, in heart, lesions vary from critical hemorrhage to myocardial necrosis. Rhabdomyolysis found the direct toxic effects of carbon monoxide and prolonged immobility leads to renal failure. Similarly, in CNS, there is neuronal hypoxic injury is most pronounced in the deep grey matter, usually in a symmetrical distribution. Punctiform hemorrhages and shortening of the cerebral cortex and corpus stratum, particularly globus pallidus. In addition to routine viscera, lungs and brain are preserved for analysis. If blood is unavailable for carbon monoxide determination, the spleen, liver, or skeletal muscle can be utilized. So, medical legal importance. Accidental cooking gas leakage in the kitchen at home. At times, mass death occur in conflagration wherein a large building catches fire. The cause of death is by inhalation of smoke containing carbon monoxide. Suicide. It is a famous agent in Western countries to commit suicide. The victim usually uses motor vehicle exhaust